Hello, good afternoon. Today's topic is psychotherapy. It's basically psychotherapy is a kind of non-medical treatment, and this particular treatment is being applied for rectifying various psychological behaviors which create problem in terms of psychological disturbances among psychologically disturbed people. Behavior, which is a global term, it's a response to some stimulation, and that particular response might be normal or abnormal depending upon the quality and characteristics of the behavior. The question is, when the behavior is abnormal or when the behavior is normal. Normal behavior means when a person qualifies or applies or acts on the basis of the vicinity of norms, rules, regulations which have to be followed by all the people of society or community or a country. So it means one is following all the do's and don'ts of behavior, which means one has to have an awareness what I am supposed to act, what I am supposed to do, what I am supposed to not to do. So those behaviors which are not supposed to be done or reflected in front of the community or society or in a group, that is a question mark, and where we try to keep our eyes so that we can reduce their frequency, their occurrence, with the aim of rectifying the psychological disturbance. The psychotherapy. In psychotherapy, it's basically a talk therapy. We use psychotherapy as a term. Psycho means psychological behavior, therapy means intervention or treatment. So, treatment of psychological behavior is a basic meaning of psychotherapy term. Now, these behaviors which are being treated by psychotherapy may be in the form of sign and symptoms in relation to thought, perception, attention, concentration, intelligence, thinking, learning, emotions, motivation, cognition, speech, receptive speech, expressive speech, and their adjustment capacity, their attitude towards themselves, towards life, towards society, and their socialization skills. According to the difference in the social norms, how much they are able to adapt in a particular situation without being influenced or without hampering their normal behavior. So, that is what is the basic meaning behind psychotherapy. Psychotherapy tries to treat almost all the psychological problems which are deep rooted into our thoughts and perception. The treatment part of under psychotherapy, which is related to the treatment of mental disturbances, is based on the using certain psychological techniques through talk therapy. What we use insight, means we generate a logical orientation within the mind of the psychologically disturbed person so that he can foresee the after effects of his disturbed behavior. We try to persuade the right behavior by making them convinced or amenable to suggestion. We try to reassure our patients who are carrying psychological disturbances through the certified and through the properly organized instructions so that patient may seek themselves their problem in a realistic manner and have a desire to cope up effectively with the psychological problems. Psychotherapy, it is the territory of a psychologist where psychotherapy is being applied by them, but it is not a hard and fast rule. Nobody else, none of the person belonging to the other field can not apply. A psychiatrist can apply provided they are trained. An occupational therapist, a clinical psychologist, a family therapist, counselors, and various other psychiatric professionals like psychosocial workers, psychiatric nurses can also apply provided they have undergone the particular training of psychotherapy. Psychotherapy, it was introduced by Jerome Frank, Jeromefrank, Jerome Frank, who discussed psychotherapy and gave the term psychotherapy in order to show the relief from distress or disability due to any reason, but it has to be at the psychological level, and the person who gives psychotherapy is called as psychotherapist, and the person who takes psychotherapy is a client. So it's a process of giving treatment by one person to another person under psychotherapy term. Psychotherapy is a kind of sustainable treatment for different types of psychological problems. I will not discard the medicines are not important. Equally, medicines are also important to control the various psychological disturbances. But as far as the modulation and modification of various disturbed thoughts and perceptual contents are there, they are being treated, modified by a psychotherapy under different sessions on a continuous basis. It is not a one day job, it is not an 1 hour job, it's a sustained treatment procedure which takes different long duration sessions. Usually the 40-minute session is sufficient, that one session is sufficient enough for 40 minutes. But if a person who is undergoing psychotherapy is not satisfied, then we may prolong the session 5, 10 to 15 minutes more, and ultimately we can pick up the another aspects to be treated or which have to be treated. This has to be assessed by psychotherapist, so we can take it for the next following session. Psychotherapy is a form of conversation between a patient or a client and psychotherapist. There are different forms of psychotherapy which our experimentalists have used, and now these are the part at present. Psychotherapy can be performed by written words, by face to face conversation, by artwork, through dramatics, through narratives, and through different plays also. Psychotherapy is not the only thing which just similarly or just simply treat the psychological disturbance. Psychotherapy is a source of expression also, an expression of unfulfilled wishes, expression of dissatisfied ideas, expression of untold conflicts, expression of lack of communication, and which creates a block in the communication, and the communication gap can also be managed and treated by psychotherapy only. Basically, it is a verbal communication process, but many times we use non-verbal communication processes also during psychotherapy. There are several systems which are being used under psychotherapy. Means what I want to convey, psychotherapy is a general term, but it is based on different foundations or different schools of psychology, different approaches of psychology. Some people use psychotherapy through psychoanalytic method, some use psychotherapy through behavior therapy or through applied behavioral analysis. Some use psychotherapy through cognitive behavioral module. Some use psychotherapy through psychodynamic. What I want to convey, psychotherapy has just different forms, which we can say psychoanalytic, behavioral treatment procedure, cognitive behavioral modalities, psychodynamic treatment approach, existential therapy, humanistic therapy, and different forms of brief, systematic, transpersonal therapies. Another important point under psychotherapy is psychotherapy can be seen as an interpersonal invitation offered by psychotherapists to aid clients in reaching their full potential or to cope better with the problem of life. What I want to convey, when psychotherapist tries to establish this psychotherapeutic session, it's an essential and a most important requirement is to have a proper rapport with the client. And to have a proper rapport with the client, it gives a facilitation to have an interpersonal relation between client and therapist. It's very important because number of psychological problems are having very confidential conflicts, very confidential details in their life, and person who is not familiar with the therapist may have certain inhibitions, conflicts, or may be having hesitation to express his problem. If the problem is not expressed properly, if the problem is left untold, then definitely the coping process, understanding the logic behind the right behavior will not serve the purpose or will not be complete. So if it is not untold and there is conflict is still going on, it will be difficult to treat the psychological problems through psychotherapy. In that case, we will not say the psychotherapy is inefficient. No, it's a clinical expertise of a therapist who, how a therapist tries to start and establish the familiar or rapport building with the client, and then how he is taking care of expression of internal conflicts so that he can reach to the depth of the problem and then can treat in an effective manner. Now, there are certain qualities within the psychotherapist or within the efficiency of a psychotherapist. The first and foremost important thing is he must be or she must be having an attitude of taking care of his client. Number two, should be altruistic. He should be help offering. He should be help giving. And he must be able to empathize with the psychological agony of the client. If a person cannot understand the basic agony behind their psychological distress, it can never be treated by them. to frame psychotherapy. There are different prerequisites to frame psychotherapy. First of all, a psychotherapist or a counselor must be well trained and must be able to create a therapeutic environment within, maybe in OPD, maybe in IPD, maybe in a practicing clinic. It's very, very important. The environment should be conducive and should be peaceful when psychotherapy is being performed. And it should be noise free, it should be free of any external disturbances so that client may feel cozy and open up his conflicts. If we go for the general module of psychotherapy, whether it is being done through behavior therapy or counseling, or it is being done by psychoanalytic, or through existential or humanistic module, whatever module is being applied, the general basic foundation is same. The first of all, a therapist must identify the goal and purpose of the psychotherapeutic intervention. Means, for what one wants to perform psychotherapy, for what aim, and what is his goal. Goal is normally to provide a comfort from the psychological distress and making the life of the client free of stress, happy. Usually, psychotherapy is being done in 3 phases. Number 1, initial phase, when we how to start psychotherapy, and when the psychotherapy is started, the person enters along with the client and psychotherapist into the middle phase of the treatment, and middle phase of the treatment is the actual session which goes to solving the problem. And when a therapist feels the problem of this particular session is being solved, then he or she reaches to terminal phase, means ending of the session. We cannot start abruptly psychotherapy. In the same manner, we can never end abruptly the psychotherapeutic session. So, the first and foremost important prerequisite to have a proper therapeutic relationship, it should be formal, but it should be little emotional also, so that patient can identify with this attitude whether this doctor, this psychotherapist is going to understand my problem or not. We have to make them to be confident and make them to understand that yes, we really want to identify and we really want to treat your problem, and you should be emotionally not burdened, rather should feel free to have an open up attitude while discussing your disturbances. Another important requirement is to take the client for psychotherapeutic intervention, he must be motivated. What I mean to say, he must be willing to undergo psychological treatment. Many a times I have seen, and during this COVID period, many of the patients who were inflicted of COVID, and when they got recovered, they were sent for psychotherapy or counseling. I found them, half of them, many of them were having problem, but half of them were not intended to accept yes, something psychological could be there. They might be distressed, they might be confused, they might not be happy, they might not be been able to adjust in their family as they used to be before or pre-COVID state. So, what was that? They were not intended to undergo, because there is a stigma in society towards the mental disturbance. People do not want to face mental health professional with this stigma that we will be declared mad. That is why they remain demotivated. They might be suffering, but they do not want to accept it. So our job is not to make them to accept it, abruptly, rather than we have to apply the persuasion to make them understand what exactly is going on and how far this psychotherapy can help them. When I started doing in initial sessions, I just tried to prepare my patients to be convinced for psychotherapy or to undergo psychotherapy. It took 2 to 3 sessions to make them convinced that yes, we want to go. Then there is a hesitation for among them within their mind, if we pursue psychological treatment, we may be turned to be, or we may be designated, or we may have a black spot that we are having mental problem. Again, I had to make them to be convinced to, instead of facing problem and becoming serious mentally disordered, it's better in starting at a mild level only. If you take care of your mental health, that will be better. So now people have started coming forward, but still this is the reason which make the patients or clients demotivated. So it is our duty to teach society, to apprise society towards the mental health treatment procedures, which is not the stigma. I found many of the doctors, they were not ready to come forward. I had to counsel them and then they started coming, but still we have to long way to go. Now, as I told you, there is psychotherapy is being performed in 3 sessions. We have to pay attention on initial session also, in the midway also, and the terminal stage of the session. We should never end abruptly. We have to pay attention. We have to prepare our patient ki now the session is going to be ended. Is there anything to be discussed? You feel like ending it, otherwise I am still having time. Don't worry, and I will definitely take care of this one. And if it is untold, you tell me, otherwise we can talk in the next session. So abruptly it should not be ended. Now, while discussing the goal and purpose of this psychological treatment with the client, we have to reinforce our patient towards the resolution of their problem. How we can motivate them? We have to induce in their mind that we are really going to reduce your emotional pressure. We will definitely unfold your untold or very confidential matters, but if you come forward without hesitation, you talk it out. Psychotherapy is based on talking out. As I told you in the starting, it's a talking out technique. So when we talk out about our problem, we feel relieved, and this relief is another addition for positive mental health growth. Wherever we find there is a disturbance, we should try to modify the habits of the client. We have to change the thinking pattern, which is negative, maybe rigid, maybe unrealistic, maybe very dreamy, or maybe very withdrawn from the general social affair. We have to change their thinking pattern so that we can make them aware of their self behavior, which is acceptable, which is not acceptable. If I say your behavior is wrong, it won't serve the purpose. I have to develop a certain opportunities or situation where client may feel where he was right